Hey guys, this is Paul Lynch. I'm an anesthesiologist and pain management doctor from Scottsdale, Arizona. I know some of you have followed me this year as I went to New York City in the spring when COVID first hit, and then ultimately got COVID myself, working in the ICU. And then over this summer and now fall and going into winter, I've tried to continue educating about this horrific disease so that I can help people. I'm calling today's video Things Are Turning Badly Part 2. And I'm making this specifically because I want to draw attention to the fact that scientists really do know what they're doing. From the vaccine to our epidemiologists to wearing masks, we're on top of this. And, I think a lot of times when doctors and scientists make mistakes, that gets a lot of attention. But I want to highlight that we've actually done a really good job of predicting for you exactly what's going to happen. And so what I want to do in today's video is I want to do a continuation of a video I did on October 29th. On October 29th, I was just blown away by what was happening with just a rapid increase, first in Europe and then coming into the United States. And I wanted to make a video that would get everyone's attention that this is a really big deal and we need to take this seriously. And I made some predictions in that video and I showed some charts and graphs and told you guys what to expect. And what I want to do in today's video is go back and show how everything that I said on that video on October 29th has basically begun to happen. And it's going to continue to get worse over the next couple of weeks. But what I also want to say is that we are not helpless. We can fight back. There are things that we can do to get this virus under control. And so what I'm going to do is kind of like I have in the past, I've pulled out all the stops on today's video. I spent probably 5 or 10 hours preparing all this. And what I'm going to do is show you lots of charts and graphs of exactly where we were, where we're at today, and where we're going. And then I'm going to finish the video with some really solid advice on how you can survive this. So I hope you'll follow me for this. Please feel free to share this as well with all of your friends. I think it is a message of hope that scientists kind of do know what they're doing, that we have enough experience with this virus now that we have a pretty good ability to predict its behavior. And if we can predict its behavior, we can keep ourselves safe. God bless you guys. I'll come back at the end and summarize everything. Okay, let's jump right into the data. This is from Worldometers. I showed you guys this data 5 weeks ago, and it showed that there's about 44 million cases of coronavirus in the world at that time. If you jump forward just 5 weeks later, and we've had a 50% increase in cases worldwide, so from 44 million to 66 million. During that same period of time, we went from 1.18 million deaths in the world to 1.529 deaths. And so we've had about 350,000 deaths in the world just over the last 5 weeks. And I think one of the themes that I'm going to talk about during this segment is how a lot of the stuff that I said 5 weeks ago happened. And that's not to pat myself on the back or say, look at me, how good we are at predicting this. But I want you guys to understand that this virus is predictable. We've had about 9 or 10 months now of watching how it spreads. And we've got to the point where scientists around the world are getting pretty good at predicting its behavior. And so the things that we're going to talk about, what's going to happen over the next 90 days, we actually have a whole lot more confidence in our ability to predict its behavior. This is a table form of Worldometers. It shows that the United States of America is leading the way with cases, not necessarily what we want to be a world leader on, but we had 235,000 cases yesterday. I'm going to dig into that more in a second. Brazil, India, Turkey, all still very high. Europe has gotten a little bit better. Europe just a couple of weeks ago made up over 50% of all cases in the world with 300,000 cases a day. And it's fallen off a little bit now, just around 200,000. So that's fairly good news for Europe as we see over the next couple of weeks. Hopefully that'll start to lessen there. And so if we look at the United States, this is from 5 weeks ago. We had 9 million cases and 233,000 deaths. And today that's up to 14.8 million cases and 286,000 deaths. Just in the last 5 weeks since I made my last kind of overview video, we've had a 63% increase in cases, and we expect that rapid rise to continue over the next 90 days. Let's dig into the data just a little bit. So 235,000 cases yesterday, that was a record. If you look at it per state, California is showing 24,000 cases, Texas 14,000, Pennsylvania 12. I'm going to talk a little bit about what per capita stuff means later, but I'm actually more concerned about a state like Indiana with almost 8,000 cases and 6.5 million people. That concerns me more than California's 24,000. And so my heart kind of goes out to my friends and family in Indiana. I grew up there, went to high school there, and almost 8,000 cases in a day is a significant amount of cases, has the potential to overwhelm the hospital systems there. If you scroll down and look at all the different states in the country, we now have 41 out of 50 states that have at least 1,000 cases in a day. This is a good time to mention that for every case that we find, there's probably 3 cases that we don't know about. And so instead of 1,000 cases in a day, it's probably closer to 3,000 or 4,000 cases in a day in all these states. I want to look at our World in Data website. It has a lot of good ways of looking at the data. So once again, starting at the world view, this is looking at total cases in the last 7 days, like on a rolling 7-day average. It kind of blends out the numbers a little better. And on a world view, we're seeing over 600,000 cases a day now on average. And unfortunately, our death rate's approaching almost 11,000 deaths per day on average over the last 7 days. I just wanted to point this out again, that 5 weeks ago when we made this video, I made the comment that the death rates had not spiked yet, and that was a good thing. But based on everything we were seeing in the data out of Europe and the way it was spreading, cases spreading so fast, that we did expect the death rates to start to spike. And this is exactly what we've seen over the last 5 weeks. So back on October 29th, we had about 6,200 deaths per day on average, and today we're almost 11,000. So just a massive increase, the amount of daily deaths on a world perspective. This is a good time just to remind you guys of what happened in the 1918 Spanish flu. There were 3 separate waves. The first wave was in the spring and summer of 2018. And the second wave going into the fall and winter, once again, people inside, congregating because it's cold, more likely to spread the disease, plus the normal flu season. And so we saw back in 1918 a 5-fold increase in the second spike. Now, most scientists don't think we're going to see a 5-fold increase, but we do know that there's going to be a big increase. And the question is just how high do those numbers go? And so if you look at a spike on this graph back in April with 6,000 or 7,000 deaths per day, now the second spike, we're getting up to 11,000. And the question is just how high does that go? It could be 20 or even 30,000 deaths per day before the end of the winter, which would be quite scary. So let's look at the same data for the United States on the Our World in Data website. This is looking at total cases, and you can just see the cases totally spiking. Now, some people on social media will say that's due to testing. I'm going to address that in a minute, but this short answer is it's not due to testing. This is a real massive increase in the virus in our communities. This is the United States data on deaths, and you can see death rates also are spiking. If you go back to the video I made just 5 weeks ago, I show that deaths had been flat, but that we should not get complacent. And this is exactly what's happened. We've seen just a massive increase in deaths. I've said this before, but typically deaths are going to track 4 to 6 weeks behind cases. And so yesterday, 235,000 cases in the United States. That's been the peak so far. That means 4 to 6 weeks from today will be our peak in deaths. Although the 235,000 case number may continue to go up. So once you kind of hit a peak on that, you'll know that your peak in death rates will be 4 to 6 weeks later. Back in October 29th, when I first did my video on how bad things were about to get, we had about 800 deaths a day. And now that number's gone to 2,000 over a 7-day rolling average. So you can just see that this bug is a little bit predictable, and our human behavior and what we do affects it. So we shouldn't act like there's nothing we can do. We actually have a lot of levers that we can continue to pull to keep this virus in check. I do want to talk about tests. I mentioned that the increase in cases is not due to test. And I just want to show you some math behind that. On July 26th, we were doing about 2.86 tests per 1,000. by August 25th, it had fallen a little bit as the virus was under a little bit better control. We were about 2.5 cases per thousand. And then just last week, that number is about 3.2 cases per thousand. Now, it did peak right before the holidays, up over 5. But generally, it's been around 3.5, maybe as much as 4 tests per thousand over the last couple of weeks. So maybe 30% increase in tests over the last 60 days, and a 300 to 400% increase in cases. So any of your friends that tell you that the extra cases we're seeing is due to increased testing, that's just not true. I'm going to put a link below so you can send them this link and maybe convince them. Maybe not, though. So how many people are in the hospital at one time? This is a new metric I haven't reported here before. I should have, but this is right from the Our World in Data website. You can look on a little tab that says hospitalizations. And pretty interesting, way back in April, we capped out just under 60,000 people in the hospital for COVID. And then in July, we hit that same number again, just under 60,000 people in the hospital for COVID. And 2 days ago, we hit 100,000 people in the hospital for COVID. We are certainly overwhelming our hospital systems. You guys hear that a lot, that we're overrunning the hospital systems, but I want to show you the math behind that. We're at 100,000 people in the hospitals, and a lot of hospitals around the country are asking themselves where they're going to put these patients. It's the same thing I saw in New York City in April when I went there. We had 2 patients in a room. We had patients in hallways. We had patients in the operating rooms that we had shut down. We had patients in pre-op and post-op and in the EDs, and just we put patients everywhere we could. And many hospitals around the country are getting pushed to their limit in the same way, and they're going to have to get creative. By the way, for any hospital administrators watching this, if you reach out to me, my good buddy Ken Sutton and I wrote like a manual for hospitals that were getting hit. It's about a 20-page document on things that we did at Bellevue Hospital, and I'd be glad to share that with anyone that needs it. So you can reach out to me on social media or any way you can. I'll get you a copy of that. So let's look at excess mortality. I've talked about this a couple times on here, but it's a common theme once again on social media, and that, COVID is not really killing that many people, and it's just replacing deaths of people that would have died otherwise, and we're labeling things COVID when it was really heart disease. Nothing could be further from the truth. And so I put together a couple graphs here today from 2 different websites that'll hopefully kind of hit home on this. This is from Our World in Data, and it actually shows the amount of people that died in excess of what was predicted week by week throughout the year. And so you'll see on April 12th, we hit 45% increase in deaths that week. That's a pretty big increase. That means if 50,000 people were expected to die, it was more like 75,000. And so that was our peak so far for the year. If you look at the lowest point of the year, the very best we were doing was the week of June 14th. We made lots of changes. We shut things down. And as you guys remember, June was a pretty good month, but we still had 14% more people dying that week than would be predicted. Now, that's a combination of COVID, and then as we've looked back over the year, we know that people have actually died more of suicide, more of heart disease, more of other things because they haven't been getting health care. But it's hard to tell exactly what percent goes to what. Probably 75% of that increase in death was actually COVID, but maybe 25% of that is other causes like suicide, overdose, heart disease, stroke. And then if you look at July 26th, that 14% increase had gone up to 28%. And then you see the numbers kind of falling off on the right side of the chart. Keep in mind, it takes us 8 to 10 weeks to compile death certificates. So I teach people a lot on charts. Don't look at the far right of the chart because it always looks better than it is as you accumulate that data. Sometimes it only takes you a couple of days to get the data. And sometimes, like death rates, it takes 8 to 10 weeks. So don't look at the far right. What I'm expecting to occur here is that there'll be a massive spike in November and December that will exceed what happened in April. And so we could be seeing 50 or 60 or even 70% more deaths than expected year over year. This is a different way of looking at the same data. The red line is 2020. This shows every single week and how many deaths occurred and how it compares to the years before. And so if you look at 2015, 16, 17, 18, 19, and the average, the dark black line is the average. That's how many people died in a week. What you'll see is that most of the time, people between 50 and 60,000 people will die in any given week. More like 60,000 in the winter months during flu and other reasons, and then more like 50,000 in the summer. The red line is 2020. Every single week, since the middle of March has been way above the last 5 years. So anyone that tells you that this year is the same amount of people dying as years before, please show them this graph. That's not true. The data's out there if you want to find it. I'm going to show you the same data one last way. This is the CDC. It's even a little bit more nerdy look at it. The CDC decides to present the data as statistically significant increase in deaths over predicted. And so the yellow line is the statistical significance line. It looks like a wave in the ocean. And the blue columns are how many people died in any given week. If there's a statistically significant increase above what was predicted, then they put a red plus sign or red X. And you'll notice there's red X's 32 weeks in a row. So basically 32 weeks in a row, we've had a statistically significant increase in deaths over predicted. I'm a bit of a nerd, so I like to look at the data this way. I'm going to put a link to this below. I'm going to jump into the Arizona data in a minute. But first, I want to look at the Johns Hopkins website. The Johns Hopkins website does a really good job of looking at all sorts of things and be able to compare state over state. And particularly if you live in a state that doesn't do a great job of tracking your data, then you can go to the Johns Hopkins website and get a pretty good sense. So this is one view that I like to look at, which is the percent positive. This is a measure that's been really, really good at predicting the spread of virus in your area, which is what percent of the tests that are done come back positive. The reason this is such a good test is a state like Arizona that's not testing very much. If 25 or 30% of the tests come back positive, then we know that it's prevalent in the society, even though our daily rates may not be as high as other states. And so this right here, the ones in red, show states that are above 30%, and the ones that are kind of orangish color are above 25%, and you can kind of go down from there. You can also look at each of the states in kind of a column view, and you can see what's happened with total tests or new cases or percent positive week over week. So it's a really good website, and you guys can kind of dig into that. One thing I want to show is just on this one view, you can click on each state and see what their percent positive is. Maybe this will affect your holiday plans. The CDC has come out and said recommend that we don't travel, but if you are looking at traveling, you might not want to go to Idaho, where 50% of the tests have come back positive yesterday, or South Dakota, there was 47%, or Iowa at 41%. Or even Pennsylvania at 34%. You can kind of play with this and look at different regions. And at the end, I'm actually going to show you a different way to do this on the CDC website. And you can filter it differently by cases per 100,000 or just total cases, or really any way you want. So Arizona is at 27.2% yesterday. They were 29% today. I live in Arizona, so I typically spend just a little bit more time talking about Arizona on these videos, and I'm going to do that again today. My biggest concern with Arizona right now is we're only testing about half as many people as the rest of the country. So we tested 241 people per 100,000 yesterday, and so that's it should be closer to 400 people, which would be about the national average. If you look at like our neighbors around us, Colorado did 757, New Mexico did 672, and if you look at our neighbors back east, over 1,000, Connecticut at 1,078, and Rhode Island 1,200. And so once again, Arizona at 241, that's just not enough to get a sense of what's going on. If you look at Arizona on a different website, this is Worldometers, and you rank by tests per million in population, you'll see that Arizona to date is fifth worst in the United States, or bottom 10% for overall testing. And you would think, well, maybe we're not testing a lot because we haven't been hit very hard, but that's just not accurate. If you look at deaths per 1 million, we're in the top 25% or 13th worst for total deaths, but bottom 10% on testing. Let's go ahead and jump into the Arizona Department of Health website. We logged 6,799 new cases today. And out of 24,000 total cases, that was about 28% positive rate. And I've talked about this before. I'm not going to belabor it today, but that you can pretty much ignore that total percent positive in the bottom right. A lot of people look at that number. I've seen it reported on the media and other places. That's just not accurate. That's the total cases to date that were positive, which doesn't really help us. We want to know more what happened today or in the last 7 days. What happened today is we were 28% positive. I'm going to dig into the website a little bit deeper. This epi curve, if you guys have been following me, I really like this. I think this is actually a smart way to do it. So good job to Arizona on that. This shows total cases that were positive on the date that the sample was taken. So not the day that you report it, but the date from which the sample was taken. I think it's a little bit more nuanced way of looking at it. And so this is the chart that I showed actually on October 29th, 5 weeks ago. And I told everyone the very worst day was right at the end of June. We had 5,460 cases. And you could see on October 29th from this one that the cases were starting to go up, but I tried to grab everyone's attention on that day to say, hey, this is getting ready to get really bad. Well, let me show you what it looks like today. It's quite shocking. We keep setting record after record the last few days. Now, this epi curve takes a few days to populate, but if you look at just a few days ago, we logged 6,885 cases in one day. And unfortunately, these numbers I expect to continue up. I think that we're going to go over 10,000 cases in a day. And because Arizona continues to lag in testing, I think the true number of cases here is far in excess of other places around the country. And so I'm worried about the hospital system here in Arizona based on what's happening right here. This is death rates. The death rates are starting to rise. As I've reported in other places, it usually takes 8 or 10 weeks to really finalize, death rates and causes of death. And so we don't always 100% know in real time, but we can see death starting to rise. We previously reported just over 100 deaths was the worst for the entire year, but I'm expecting that we could have days over the next 90 days here that could approach 200 deaths in a day. This is hospitalizations in Arizona. You can see that the hospitalizations are going up, up, up. If you have a healthcare worker in your family, then you probably know that they're working really long hours and they're getting stretched to their breaking point. This is directly from the Arizona Department of Health website, and it shows that we only have 8% of intensive care unit beds available. So only 8% of our ICU beds are available. That's the very worst number reported so far in 2020. And if you look at total inpatient beds available, that was also the very worst reported in 2020 with only 10% of beds available. It's interesting, a lot of people like to talk about ventilator availability as a good thing, and so Arizona does in fact have 55% of all ventilators available. But this is one of the things that's really interesting. If you go back to the spring, everyone was really worried about ventilators, and we purchased a bunch of ventilators, and we bought ventilators, and we talked about putting 2 patients on one ventilator. What I found in New York when I was working in the ICU is the ventilators weren't the issue. The issue was having enough ICU beds to put them in and enough ICU staff like anesthesiologists like myself or ICU nurses. That was the bigger issue. So if you look, we have plenty of ventilators in Arizona, but we don't have enough ICU beds. So 55% ventilator usage, or 55% ventilator availability, but only 8% availability of ICU beds. And so this is something we're going to have to keep our eye on over the next couple of months, that our healthcare systems are getting to the point we just can't manage all these patients, and we'll have to figure out what to do at that time. I want to touch on just Oklahoma. I've mentioned I grew up in Indiana. I live in Arizona, but I also lived in Oklahoma for like 10 years. I've got a lot of friends and family in Oklahoma. I just want to mention to you that it looks really bad in Oklahoma as well. There was a day last week that logged over 6,000 cases in one day. But if you look at that on a per capita basis, Oklahoma has 3.9 million people. California, interestingly, has 39 million people, exactly 10 times more, so it makes the math easy. 6,257 cases in Oklahoma would be like 62,000 cases in the state of California. And so I would just tell all my friends in Oklahoma and all my followers in Oklahoma, please don't get complacent. You have some really bad months coming ahead the next 2 or 3 months, and those 6,000 cases in a day are going to start dropping to the bottom line. It won't be unexpected for Oklahoma to start logging over 100 deaths a day, which is quite significant in a state of only 3.9 million people. Speaking of the concept of per capita calculations, I'm going to put a link below where I've been doing a lot of per capita calculations myself. It's right from the CDC website. It's really good, and you can search the data a lot of different ways. So let me show you an example. This is a color-coded map of the United States showing you how many how many cases there have been in the last 7 days. And your eyes jump straight to California and Texas and Florida and Illinois and Pennsylvania and Ohio. And that's correct on a total case basis. So you think, well, I want to be really careful going to Texas right now. It's really blowing up. But what if you sort the data differently? What's really cool on the CDC website, and I'll put a link, is that you can also sort it by cases per capita or cases per 100,000. And so on this map, Texas looks really terrible. But what if we look at it on a per 100,000 basis? Now Texas turns green and Oklahoma actually looks worse. And that's because Oklahoma on a per capita basis is actually doing worse than Texas. Now, I will say, if you dig into the numbers, almost every state in the United States now looks bad. There's no state that's really good. All the states are just dealing in kind of subtle differences. But I do think it's interesting, and I'll just show you again. If you look at how many cases there are, California, Texas, and Florida look terrible. But if you look at how many cases per capita, California, Texas, and Florida look a little better. So a little bit of it is just relative to what metric you're looking at. And at the end of the day, we're all getting hit really hard right now. I'm going to finish this section by reminding everyone of the Nature article. This was written in mid-September and predicted exactly what was going to happen over the next 2 or 3 months. And I reported on it about 5 weeks ago. And I just want to mention again that almost to the number, the CDC has predicted exactly how many people would die. Unfortunately, the numbers continue to look bad. This is the updated number from the IHME website, and I'll put a link to this below as well. Once again, it shows by March 1st, we're going to have around 500,000 total deaths from COVID-19. What does show a little hope on here is that there is a range of outcomes based on our behaviors, that we are not completely helpless in this situation. On the upper end, we could lose as much as 666,000 deaths. On the lower end, we could lose only 444,000 if everyone wears a mask and socially distance. And so there is 222,000 lives hanging in the balance based on our behaviors, what we do as states, as local and city governments, as what we do as humans, how much we congregate over the holidays, and whether or not we wear masks. So I do just want to continue to urge everyone who's watching these videos to do everything they can to save their fellow man. Okay, I hope you guys enjoyed that. I'm going to put all the links below too, so if you don't understand anything I said, you can dig into it yourself. If you have questions, you can always reach out to me directly on my social media pages, and I'll do my best to answer. I'm going to now finish this video with 4 things you can do to help survive this winter. So number 1 is I'd like to encourage you guys to reduce your social contact or reduce your human contact by 90% over the next 90 days. Now that might seem really hard, but it's really not that hard to do. It just requires you to be mindful. I was on the news this week and I said, the safest thing we could do is have 0 human contact, but of course that's impossible, but we can make concerted efforts to reduce our contact. So let me give you an example. At my practice, we have 4 different clinics, and I've encouraged the people at work, if you want to go see someone after work, try to see someone that works at the clinic where you're already kind of exposed to their germs. But if you go hang out with someone in a different clinic, now you're mixing germs from one clinic to the next. And so that's just one simple technique you can do. Another one is you don't have to go out to bars or out for dinner. And there's all sorts of other decisions you can make in your life to reduce your human contact by 90% over the next 90 days. We see light at the end of the tunnel. This is not forever. This is probably 5 months at this point that we're going to have to really change our behavior, and then we're going to be back to fairly normal with the rollout of this vaccination. During this time, don't feel like you're being tortured. Find something fun to do. Learn to paint or go for walks or maybe take up golf. But just reduction in human contact doesn't mean you have to be depressed or sad. There's a lot of nice and fun things that you can do and even explore new hobbies over the next 90 days. Number 2, this is more for business owners and state leaders. We have to ramp up testing in Arizona. We have got to ramp up testing. We're not really going to have our handle on what's going on unless we know how many people have the coronavirus. I myself have kind of put my money where my mouth is. I bought 4 machines 4 weeks ago. The first one was delivered last week and we tested it and it worked. We could get answers in 15 minutes on whether me or my staff have coronavirus. We're going to roll this out for our patients at Arizona Pain over the next couple of weeks. It's not all completely set up yet, but if any of my friends and family or extended relationships in Arizona need to get tested, you can reach out to me. We should be able to test you as early as next week. But it's not just about what we're doing. I'm encouraging all businesses to look at whether they can get testing machines, on whether they can make relationships with hospitals or labs. But we need to double down on testing. If someone has any symptoms at all, we should test them. It's the only way to truly figure out what's going on in Arizona. Number 3, and this I talked about at length this week, get vaccinated. The data is really, really good. The Pfizer and the Moderna studies both showed over 95% efficacy. The sooner we can get probably 80 or 90% of society vaccinated, the sooner we can get back to living the lives that we love. So I encourage everyone to get vaccinated. I understand we don't know the long-term effects. This vaccine is new, and so there's no way we're going to be able to tell what happens 30 years from now, but there's no reason to believe from the data that a small little piece of messenger RNA, which is just genetic information to make a spike protein, there's no reason to believe that that small little segment of messenger RNA is going to cause major effects long term. So I encourage everyone to get vaccinated. And number 4, the mantra that we've always talked about: wear your mask, socially distance, wash your hands, and get tested. If you do those 4 things, you're going to protect yourself and stay safe. I just want to finish by saying, please share this video. If there's people near you that you think need to see this, share it. I've done everything I can during this year to educate and look back at this time and feel like I did everything I could to save lives. And you can actually save lives too by sharing this if you think someone needs to hear the message. God bless you guys. Stay safe. Give me 5 more months of behavior change, and we'll get back to normal.